NOVIDIC is a real-time pandemic tracking and management system developed by Universal Apps Australia. The system relies on geo-QR code tagging technology, which uses QR codes to locate any suspicious infected individuals in real time and prevent the spread to others. The system is privacy sensitive and does not use GPS, Bluetooth or microphone for detection. The NOVIDIC algorithm is a visit or who-where based model rather than a contact or who-who based model. NOVIDIC records the visits to particular high-risk places only and does not chase people's social interactions in their private zones. NOVIDIC works as follows. Businesses or public places such as hypermarkets, gyms, cinemas, places of worship, schools or even airport terminals are considered high-risk places in a pandemic. Such venues should set up a place in NOVIDIC system and display the QR codes generated at the entrances or gates. They either can display a static printed QR code for small places or use dynamic QR codes displayed on iPads, tablets or desktops. The system works completely web-based for places, visitors and the agency. However, the mobile app is available as an option. Hence, people are not required to download or install any app if they don't wish so. They may use their mobile default scanner and access the system via a web browser to scan and tag their visits. Individuals should register a simple account by providing only their mobile number and age gender group to be able to use the system. Any visitor must scan the QR code displayed at the place to tag his or her visit. By the way, the system supports manual entry by the place employees in case a person has no phone or is a child. Visitors should also give estimated duration of their stay by tapping a timer upon scanning the QR code. However, the place management can put a limit for the maximum time a visitor can stay in the place if it is needed. Once visitors confirm the duration of stay, they have technically checked into the system in that place. Once they leave, they need to tap exit, or upon scanning a new QR code for a new place, they are considered out from the previous place. It is useful for public places people pass through many sections gate by gate, like in an airport. By the way, the system monitors allowed capacity of each place in real time, and if it is full, it will reject entry when a visitor scans the QR code. If they don't leave when the time is over, the system will send them a reminder to leave the place. An authorised healthcare agency shall have access to all database of the system and is able to track back all national-wide visits up to the past 30 days. If a person is tested positive for COVID-19, a healthcare officer can immediately track back his or her visits and see what places he or she has visited before and evaluate the risk facing others based on the place type or capacity and the duration of stay. The agency is able to search for whoever has visited the same places at the same time as first-level encounter and filter visits based on duration of stay. The agency even can search for delayed visits or third-party visits if needed as the second-level or the third-level encounters. An officer is able to notify whoever has been looked up in the search by sending notification or SMS directly from the system should the officer conclude that they are at risk. The agency also can red flag a person or a group if required to stop them visiting more places. Such red flag persons will not be able to enter any place and will be rejected upon any scan of the QR codes. The agency can also make a place red flagged in real time if such a place is considered a very high risk zone to stop the spread until they can contact the place managers. If a place is red flagged, people will get a warning upon scan, "Do not enter. This is a red zone." There are advanced search tools and filters available in the system. NOVIDIC gives confidence to healthcare agencies to control the situation by quick response and a more practical approach to face the outbreak. No COVID by NOVIDIC, the most unique pandemic tracking and management system in the world.